a Motown Bumper Music Friday. Dr. B joins us, our friend, Chief Medical Officer at People's Health. I guess you're a fan of Motown, huh, Doc?
Yeah, I love Motown.
Boy, when you watch it, it's amazing how many hits they had. Well, Medicare's annual enrollment period ended on Tuesday, but you might still be able to change your health plan. Dr. B is here from People's Health to talk about the different Medicare enrollment periods and how you may qualify for one. So, Dr. B, what is the initial enrollment period?
Sure. So the initial enrollment period is when you're first eligible for Medicare. So you actually have a 7-month window to sign up for Medicare if you're interested, and it actually begins 3 months before your 65th birthday, and then it lasts for 3 months after your 65th birthday. So if you turn 65 in June, your period's going to begin March 1st, and it's not going to end all the way until September 30th. So you've got that 7 months to decide what you want to do.
What is the annual enrollment period?
So annual enrollment period is really what we just wrapped up, what we just finished on December 7th. So that period runs every year from October 15th to December 7th. And that Medicare annual enrollment period is the time where you can actually decide that you want to change your coverage. So if you're in original Medicare, you can switch over to a Medicare Advantage plan, or if you're in an Advantage plan, you can actually switch back to original Medicare as well.
So we've gone through initial enrollment, annual enrollment. That brings us to open enrollment. What is that?
So the open enrollment period is actually from January 1st to March 31st. So that's going to start in just a couple of weeks. So what that period is for is it's for anyone who did join a Medicare Advantage plan. If they decide they don't want to be in that plan, they can actually switch back to original Medicare. So it gives them the opportunity to say, maybe I didn't make the right decision, so I'm going to switch back to original Medicare. You also at that time can switch to a different Medicare Advantage plan. So if you find out that maybe something's not covered in the plan that you chose and you want to make a change to it, you've got that one period during the first 3 months of the year, that open enrollment period where you can actually switch.
And as if that's not enough, there's special enrollment period. What is that?
Yeah, so the special enrollment period, like it says, it's special. So there's a couple of different events that trigger that. But in particular, a lot of times it's a life-changing event, something like moving, so if you move out of state or into the state, if you lose the health insurance that you have, maybe you had it through work or something, then you may qualify for a special enrollment period. And the rules are a little bit confusing with special enrollment periods, so there's a lot of different reasons why it may be triggered.
And that's referred to as SEP, which looks like September, and don't let that confuse you. If you have both Medicare and Medicaid, do you have a special enrollment period?
Yeah, you do.
Or can you change it? Well, how's all this work?
Yeah, so one of the special enrollment periods is actually for people that have Medicaid and Medicare. So if you qualify for both of those programs, then you actually have the opportunity to switch your plan once per quarter. So basically, every 3 months, you get the option to switch plans. And the last quarter of the month, which is that October, November, December, really is the annual enrollment period. The other thing to keep in mind is if you qualify for Medicaid sometime during the year, or if your level of assistance within the Medicaid program changes, then you're also going to qualify for a special enrollment period.
All right, let me take a quick break. When we come back, we know how hurricanes can be disruptive to our lives, and of course that can be disruptive and can change Medicare as well. So we'll talk about that when we return. Dr. B, our friend, our guest, Chief Medical Officer of People's Health, talking about senior health and the differences with Medicare, that now that the annual enrollment period has ended. It ended on Tuesday. Back in a flash. Right now, time for traffic on WWL. 8:25, Tommy Tucker, WWL, on his Friday morning, December 10th, day 103 of the Ida recovery. Speaking of which, we're talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Now that Medicare's annual enrollment period ended on Tuesday, you might still be able to change your health plans, but there are some differences and some conditions when it comes to Medicare. One of them, I guess, Doc, is hurricanes, right?
Yeah. Unfortunately, we experience this quite a bit, almost every year it seems like. But what happens is, we were talking about special enrollment periods and what triggers that. And one of the things that can trigger a special enrollment period is when FEMA declares a weather-related emergency or some sort of major disaster like a hurricane. And so what that allows is for Medicare beneficiaries who, because maybe they were displaced from their home or they had other things going on, they need more time to decide what plan they want to be in. And so, with everything that went on here this year and in years past, you may qualify for one of these disaster-related special election periods.
Let's talk about Medicare star ratings and the enrollment period. How does the Medicare star rating affect the enrollment period? Yeah,
sure. So, I love to talk about this year because we're very excited that People's Health is going to be a 5-star rated plan for 22. And what that means really is if a Medicare Advantage plan achieves a 5-star rating in your area, then it means there is what's called a 5-star special enrollment period. So what that means is that if you're with a plan that is not 5-star and you want to switch to a plan that is 5-star, like I said, that's in your area, then you can use that special election period just once between basically now up until November 30th of next year. And like I said, we're super excited to be 5-star. A lot of work went into that this past year.
Yeah, and if you can, Doc, explain why that is that star rating is so important and why what it is, I guess, and why it's so important. And again, y'all ought to be proud of that 5 stars.
Yeah. Medicare uses this star rating system basically from 1 to 5 stars, with 1 being the lowest performance and 5 being the highest. And the way that they calculate it is kind of interesting because they use a lot of survey information from current plan members, so people who currently have People's Health, and they ask them how they feel about the service they're getting. So it's really taking into account the members' experience, the customer service we provide, but then they also layer in things like how the plan helps their members manage chronic problems, long-term medical problems. Do they help their members stay healthy, and do they help them with their prescription drugs? So it's a really good way to compare plan by plan what the true experience of the people that are enrolled in that plan are.
It seems like it can just be overwhelming for people. I'm telling you, since we've been talking about this, and I'm not close to it, but my eyes have glazed over. I have no idea. And you've done a great job of explaining it, but it can be overwhelming.
It's a lot of information, and anybody who's gone through this for themselves or with their parents like I have, it is a lot of information, and sometimes you just need to reach out and get somebody to help. Sometimes it's easier to just talk to somebody to figure out what all of these things mean, and we're definitely here to help with that. I've mentioned it before. We've got a Medicare Center in Metairie, right next to Party City at Veterans and Causeway. You can definitely call us anytime and talk with someone. They can talk through a lot of the things we've been discussing over the past couple of weeks, and hopefully get you enough information to make the right decisions for you.
You don't need an appointment. You can walk in, but it'd be better probably to get one at the Medicare Center.
Yeah, we've asked people to get appointments. We are practicing social distancing and being as safe as we can, but you can talk to us on the phone or just make an appointment. There's definitely some available.
Doctor, thank you. I'm on vacation next Tuesday through the end of the year, so Merry Christmas and Happy New Year to you.
Yeah, you too, Tommy. Have a great Christmas and holidays.
Thank you, sir. You can go to peopleshealth.com to find out more about People's Health. You can call 1-800-978-9765. TTY users may call 711. You can visit that People's Health United Healthcare Medicare Center, 3017 Vets in Metairie, next to Party City at Causeway. Appointments are recommended, but they accept walk-ins. You can follow People's Health on Facebook, Twitter, and Instagram. 8:30 time for WWL First News. For that, we go to Dave Cohen.